Are there any additions to the agenda? Any changes?
I believe Mark wanted something added to the agenda for discussion.
About what we talked about with the post, is that what you're referring to?
Yeah, the email you sent me.
Yeah,
Okay.
yeah.
Okay. And you want that in new business, right? Pen, where's my pen? I just had it. Okay, anything else?
No other changes for me.
Okay, so I'll entertain a motion to approve the agenda as amended with the addition of Mark's.
Make a motion to approve the past agenda,
Second.
or the agenda.
Second it.
Thank you. Who
Roll call
seconded?
vote.
Sorry.
Cody?
Cody, thank you. A roll call vote.
Vivian Goodman,
Yes.
Mark Scranton,
Yes.
Jan Hack,
Yes.
Candy Clevenger,
Yes.
Jeff Endler,
Yes.
Debbie Hill.
Yes.
Cody Parks.
Yes.
Dr. Janet Patterson.
Yes.
Okay, motion carried. Thank you. Public comment.
We do have someone here.
Okay.
I didn't receive an email, but we do have someone present.
All right.
Good evening, distinguished board members. My name is Adrian Owens. I am district manager for HC Foods. We actually own the Popeyes. We actually had one here in Decatur. We actually oversee 10, we're currently 11 Popeye restaurants across central Illinois. A couple of years ago, I guess there were some issues with the establishment here within the Decatur region. Since then, we have all those individuals that were a part of that whole operation. It's no longer with us, and we would like an opportunity to come back and service your community, if at all possible. I know I have 2 other locations in the Springfield area. And believe it or not, I have a lot of frequent customers from the Decatur region that drives that, what is it, 27? I'm from Peoria, so and so I drove down here for that, but for this particular meeting. But we have a lot of of your of Decatur residents that drives around to our other local establishments, such as the Bloomington restaurants, the Springfield restaurants, the Champaign restaurants. And I actually was born right here in Decatur. As a matter of fact, this very building that we're sitting in actually used to belong to my family. My grandfather used to have my great uncle used to actually have his garden right here for years. I don't know if anybody remembers when this used to be a garden area, but that used to belong to my uncle. So me personally, I have ties here to Decatur as well. I was born right in Decatur Memorial Hospital. I graduated from Stephen Decatur High School. I went to Mallow Middle School. So all these things that makes Decatur Decatur, I'm gung ho on it. And guess what we did not have when I was a little boy in Decatur? We had a showbiz, but we did not have a Popeyes. So, and I think that we're kind of missing out on that and that experience. And I'm just saying that if we actually had an opportunity to come back to your community, we would do everything we possibly can to make sure that the establishment is ran right. Safety is first. I've been doing this for 32 years. Matter of fact, my very first job was right over at East El Dorado McDonald's. So that's how long I've been doing this. I got hired on my 15th birthday. So this is something that's not a job to me. It is a career, it's a passion. And I really hope that you guys will consider allowing us to come back and kind of prove ourselves. Thank you.
Brandy, are we allowed to ask questions, public comment on something like this or not?
I believe that you are.
Okay.
If you wish to.
So is the management team you have in place currently, do they oversee these other facilities in other towns that you're referring to? Is it the same?
I'm not understanding
Your management team, do
That was here?
your management team, is it the same management team that oversees your
There is
Bloomington?
nobody that was
Springfield?
part of the Decatur management team that is a part of our company anymore.
No, I'm not saying that. I'm saying you as a franchise, I don't know if it's franchise or franchisee or whatever, is your group the same group?
We
that
are the
oversees
largest
their
franchisee,
locations?
owner-operator in the Popeyes region. We actually own 482 Popeyes
Wow.
around the country. So I guess on the terms of franchisees, we are, but I think we're more in a corporate field, if that makes sense. We're a corporation within a franchisee. So, and one of the things that I just actually got named as a senior district manager, so I'm actually I have my own particular territory, but I'm actually overseeing all of the central Illinois.
That's what I was
locations.
asking. So
Yeah.
you're over several locations.
I'm over every central Illinois location. So
Okay.
the central Illinois locations that HC Foods actually operate would be Danville, Champaign, Bloomington, Springfield, Peoria, Moline, and Davenport.
So the same franchisee that has multiple locations you're referring to, are they the same ones that had control of this store?
Yes. Now,
Previously?
with that being said, we had just acquired the Decatur's stores through an acquisition. Obviously, we bought out the old owners.
Okay.
And so a lot of the different issues that was a part of that restaurant, we inherited, and we were in the midst of obviously correcting. I'm going to be honest with you. The details of what happened in particular, leading up to that, we were kind of in the dark about, obviously because we inherited the issues. But I will tell you that we actually have used the Decatur incident, me personally, what I did within my region, within Central Illinois rather, is that we've actually laminated the health department, the state of Illinois health department inspections, and we use that as a template before the store even operates on a daily basis. And our managers are required to send that to me on a daily basis. And then we have 3 or 4 other different type of auditing mechanisms that we use, as well as an independent auditor. As a matter of fact, I just left Peoria, going through 2 different audits today. So we score, the highest score you can actually score is a 5. Out of all of my locations, I probably have 2 that's a 3. So, and those are, again, under new management as well. So they cannot score anything less than 3, obviously. That is completely unacceptable. We'll be finding management. So.
Have you had failures like this with any of your
Never.
other locations?
This is our first and only.
Okay.
Any other questions? All right, thank you, Ms.
Thank you.
Owens. Okay, we'll move on to approval of the previous meeting minutes. The minutes from March 15, 2022. I'll entertain a motion to approve the minutes.
So approved.
Second.
Second, any discussion? Seeing none, roll call vote.
Vivian Goodman,
Yes.
Mark Scranton,
Yes.
Jan Hack. Yes. Candy Clevenger,
Yes.
Jeff Entler,
Yes.
Debbie Hill,
Yes.
Cody Parks.
Yes.
Dr. Janet Patterson.
Yes. Thank you, motion carried. Communication?
Okay, I have some updates for you. The first is you should have a certificate at your spot. As part of National Public Health Week a few years ago, we started just wanting to do a little bit of something to recognize our board members and say an extra thank you for your time and your service. So thank you so much for everything that you do and for your support and for showing up and helping advocate for public health. Now, other updates I'd like to give, contact tracing numbers. I did send you an email on April 8th about some changes that were made. We did have another contact tracer moved into a permanent health department position. joining WIC in a clerical position, so we were very happy about that. And then we did an additional transition on April 2nd for the remaining 4 full-time people that we discussed last month. And 3 of those people went to that part-time PRN as needed status, and 1 of them is full-time handling all of the COVID responsibilities specific to contact tracing and any type of support for that. COVID prevalence, we have seen a slight uptick in Region 6 of COVID cases. We were asked to be on a call by IDPH on Thursday just to go over that and kind of discuss what types of messaging would be effective in our areas and what we should be doing to continue to remind the public to take public health precautions. Macon County is still in a low community level, and our case rate change in Macon County in the last 7 days, and that was as of the 17th, was 30.16%. And for the Region 6 as a whole, as of that meeting on Thursday, April 13th, the cases in Region 6 had doubled over the previous week. The percent change was a 103% increase. It was the highest increase in the state that week. Next highest was Region 9, which is North Suburban Cook. Most cases are in the 20 to 29 age group. Hospitalizations are stable. So I just wanted to update you on that. And then contact tracing logistic updates. We did talk about most of this last month at our board meeting, but just wanted to let you know these things have been implemented over the course of time. Our COVID operator and COVID vaccine hotlines have been closed. Both have recordings of where people can call to receive assistance so that they don't just have a ringing phone with nowhere to go. Our COVID email box, that has also essentially been turned off, but there is an out of office message again with the information about where they can reach out and get the assistance that they need. We did switch to Monday through Friday with no holidays, as we had discussed. Our emergency answering services are still intact. Reporting was moved to 1 day per week on Thursdays. Another thing associated with COVID, as far as my COVID update, that I thought would be really impactful for you to all hear, and I did get the opportunity to share this with all staff during our last all staff meeting. We're not supposed to send out what the state sent us for this, so I'm going to communicate it to you, and hopefully you can share this really impactful news. So they did a webinar to discuss the contact tracing impact metrics in each area. And we were able to receive information specific to Macon County and the impact that our contact tracing work had alone. So this does not take into account the vaccines that were done or any of the other work, the testing or anything else, contact tracing. And the time period reflects August 1st of 2020 through January 13th of 2022. The estimated number of hospital admissions that were prevented in Macon County alone was 98 to 162. The number of hospital bed days that were prevented for our Macon County residents were 485 to 728. Hospital ICU admissions prevented, 21 to 34. Hospital ICU bed days prevented, 256 to 421. And out of the confirmed cases during that time period, the number of infections estimated to be prevented by our contact tracing team was 5,776. And the number of deaths prevented during that time period in Macon County alone was 91. I thought that was really impactful because we've told the staff, you know, thank you for everything that they do. And we've talked about they've protected life, they've saved lives. We all know that COVID also impacts quality of life for those who do not lose their lives to it. So the number of people that our team were able to protect and positively impact with their contact tracing work, I was really thankful to see numbers and be able to share those with the team and actually have something quantifiable. So I thought you all should hear that. I thought it was pretty amazing. Any questions about COVID? That's all of the COVID communication before I go to the next update. Okay. Flex time accrual update. You do have a report in front of you, and that does reflect, it looks the same as it did last month. I did have Cherie take off the payroll dates because I think that maybe caused a little confusion. So it basically just says the beginning and then the end date, the amount somebody started with by the position title, and the amount somebody ended with. It is in alphabetical order. Everybody's on here. Does anyone have any questions about that?
I'd just like to say, job well done. It looks like it's being managed very
very effectively. I would assume you would say the same.
I definitely agree, and I do feel like, COVID has been in a place where we have been able to drastically decrease the number of hours some staff are having to work. I hope that it remains that way. Obviously, we're always, kind of watching for what's going to happen next. But again, contact tracing does not look the same now. So even if or when we have another surge, which they're talking about could be weeks, months, or as late as in the fall, our work in my opinion, from what we are being told and how contact tracing has changed, our work will not be the same as it has in the past. So I do feel confident that staff can handle it. We have kept these staff on as that PRN or as needed if we have to call them up to help with some things, so that our core permanent staff don't have to take all of that on as they had to in 2020. And that should help limit the amount of flex time they would accrue and allow for them to take their time off. All right, and then the last thing that I wanted to just update you on is we had talked about those division director mini presentations. We are starting that this month. We'll do it during the department division reports. And I know that we also talked about attendance of division directors in person. Some of them are here tonight. They will all be here next month. So just wanted to let you all know those updates. Does anybody have any questions for me?
Okay.
Thank you.
Thank you, Brandy. Financial report, Sheree.
Okay, the report in your packet is through the end of March, and we were 33% into the fiscal year. Ending fund balance is at 7.1 million. Total revenue at 2.9 million, which is 42.6% of budgeted revenue. Total expenditures at 2.2 million, which is 31.9% of budgeted expenditures.
We'll entertain a motion to approve the financial report or accept the financial report.
Approved.
Second.
Okay, any
Who
discussion?
first? Sorry, who's first?
Cody?
Cody,
Thank you.
and you get the second.
No,
Mark.
I thought it was the other way around.
If no discussion, roll call vote, please.
Vivian Goodman,
Approve.
Mark Scranton,
Approved.
Jan Hack. Approved. Candy Clevenger,
Approved.
Jeff Entler,
Approved.
Debbie Hill,
Approved.
Cody Parks,
Approved.
Dr. Janet Patterson.
Approved. Motion carried, thank you. All right, department expenditures are in your packet. I would entertain a motion to pay the bills.
So moved.
I have,
Jeff and Candy.
Vivian, I have a question on one of the expenditures.
Sure.
What is, Brandy, what is, I guess she needs to answer it better play. What is this Hope Motor Coach advertising? What is that for?
That is bus ads in the community. I don't know
For $1,800?
There's one for
which page is it on.
BBO.
Okay, so it's for our BBO program, Better Birth Outcomes. That is one of our state grants through DHS, and a portion of the funding was approved for bus ads in the community.
How long a time period does that cover for it? Do you know?
I do not know that off the top of my head. We can get you that information.
Okay. Is that something that the health department's done in the past?
Yeah.
Has it been effective?
So they usually
I mean, I
just,
know it's hard to gauge that stuff.
yeah. So they'll give us reportable numbers of how long the particular ad ran, and then estimates of, depending on where your ad is placed on the bus or in the bus, of how many people it would potentially reach and what routes it would be on, so that you can try to target where you want that message to go out. Now, they can't guarantee that many people would see it, but it's kind of like placing an ad anywhere else. You just go off of the best estimates and try to use those dollars as effectively as you can.
Now, is that the marketing company that the transit authority uses then? So it's through them?
The Decatur city buses,
Yeah.
that, I don't know that it's like through the transit authority, but that's who they use, like if
Right,
anybody
that's what
wants to
I'm
place
saying,
the
yeah.
ads, yes.
Okay.
Any other questions? Okay. Roll call vote, please.
Vivian Goodman,
Yes.
Mark Scranton,
Yes.
Jan Hack,
Yes.
Candy Clevenger,
Yes.
Jeff Entler,
Yes.
Debbie Hill,
Yes.
Cody Parks.
Yes.
Dr. Janet Patterson.
Yes.
Motion carried. Thank you. Grant applications for review.
We don't have any this month.
Okay. Great. Department division reports. So,
I'm going to introduce Rachel. She'll introduce herself, but Rachel is our first mini presentation. And Rachel is our Director of Clinical Nursing Services.
Hello, everybody. Let me get my microphone situation here. So I'm Rachel Deerwester. As Brandy said, I'm the Director of Clinical Nursing Services. I've been with Macon County Health Department for a little over a year. So I joined at the height of the pandemic. I know Brandy covers COVID with you guys every month, so I wanted to use this as an opportunity to outline some of the other programs that we have in clinical nursing. So we have several different grants we work under. Communicable disease is probably our most prevalent grant, along with our immunization program. So we serve to control the spread of a wide variety of communicable diseases with investigation and surveillance in Macon County. A good example of that for you guys that could kind of sum it up for you would be if you see the USDA put out like a listeria in lettuce or something like that. That can stem back down to the little local health department that identified a cluster of people that went to the hospital and they tested positive for listeria. They tested for, salmonella or something like that. And they identified a cluster and said, hold on a minute, where'd you eat at? And so somebody like my team would call that individual and do a food diary with them and say, where did you go? Where did you eat? How can we track back where this illness came from? And sometimes they can use that data to identify if there was something like lettuce, for an example, because that happens frequently, that was distributed into many different counties to kind of pinpoint where that came from. So that's a little bit about what we do with communicable disease. We also work with foreign travel. We do immunizations for people for foreign travel. We do immunizations for everyone from 2 months of age to end of life. So all of your back to school immunizations. In the fall, we do several flu clinics and back to school clinics throughout the community. We also have our HealthWorks program, which is where we have caseworkers that work with DCFS youth in Macon County to ensure that they are getting all of their needs met during their first 90 days of service. We have a medication management program where we have a nurse that goes into patients' home that are unable to leave their home and are medically or are homebound and have medical needs. This nurse helps these patients stay within their home and not have to go to a facility to receive the care they need. We have a tuberculosis program. We provide TB screenings in-house 3 days a week for, a ton of people need TB screenings. I'm sure you guys, have come across that in your time. If you have anyone who works for basically any healthcare entity, they're going to be required to have a TB screening, and there are other jobs that require that as well. So we offer that service. We also work with the West Nile. So we work with the Decatur Mosquito Abatement Program, and we kind of help them track along with that communicable disease aspect when we see things like West Nile pop up, trying to centralize where that is. We work with our environmental health team on that as well. We do provide lead testing to everyone ages 1 and older. We do work with environmental health through Champaign County that goes out and does home inspections based on findings. We are a Narcan distribution center. We have actually been working extra hard lately with being able to open a little bit more accessibility to Narcan in the community. Been doing some in-services and some education and being able to actually distribute Narcan to different organizations in the community, churches, organizations where we know that people who frequent may have a need for that. And I saved the best for last because I'm excited to let you guys know that we are opening our full STI clinic on May 4th in partnership with Crossing. So we are going to start by opening that clinic all day on Wednesday. That is the availability Crossing has for us right now. We're going to get a good workflow down, and then in July, we're hoping to extend those hours and add in another afternoon, hopefully a Tuesday afternoon. So once we get, right now, we're going to do that by appointment only. Once we get a workflow down, since a lot of our nurses were not here before, and we've got this was a program that we always had before, but we're kind of starting over, now that we're getting to, I don't want to say past COVID, because I don't know that we'll ever really be past COVID, but now that we're getting to a good place with our infection rate and are able to put our focus on getting back to some of our regular services. So we're excited to start that back up. And that is kind of just a brief overview of what we are doing right now. So I'm just going to pause and see if you guys have any questions.
So the new clinic you're going to start with Crossing, has it been done that way in the past, or is this a new?
That is how it was done in the past,
Okay.
yes. So it's kind of a new set. It will be a different provider, but we've been working with them directly to kind of get that back up and running. But that is who we previously used, yes.
So what does that mean for patients? Are they having to go there and then come here, or how does that
No,
work?
they will be able to come in here to get their STI testing. We will be able to treat on symptoms, but then if we have to wait for results, we will call them here at the health department and let them know what their results are, or certain STIs do require them to come in and have an in-person counsel session. So we have nurses that are trained up to do that as well. If the patient, one of the things that I think is so important about this partnership with Crossing is because at the end of the day, we really want our patients to have a primary care provider. You can come into a clinic and you can get a test and you can get treatment, but it goes beyond that. We want our patients to be educated on their overall health all of the time. So creating this relationship that we are going to have by bringing our patients in here to get their testing done, we can also present them with an opportunity to establish a primary care provider for their other needs as well through that partnership with Crossing.
So Crossing has been having actual direct involvement with the clinic then?
Yeah, their provider, yes, our nurses and their provider will be working together to take care of the patients that will be here for the STI testing and treatment.
Rachel, how big a team do you have?
Well, previously with COVID, I had over 50, but now that those numbers have declined, I am down to 19. Well, I should say 19 with a full house. I have one vacant position, so 18 plus one.
Is that all nurse staff then, or?
No, I have nurses, I have social workers, I have, my front staff, I have my staff that goes in. Did I say MICV? I think I missed MICV. We also have our Healthy Families Illinois program, our MICV program, and those are home caseworkers that go in with high-risk pregnancies and newborns, and they're able to kind of do a lot of education with the parent and help them with their new child as well. So we kind of have a variety. It's not necessarily all just clinic staff, if you will.
What was that called again?
MICV.
It's MIECHV.
Yeah, that's a hard one.
Would have never got that. Rachel, what are some of your successes or challenges that you deal with?
Yeah, so successes, I think that we have done a really great job of taking care of the demands of the community in the time. So whether that was COVID or getting this STI clinic back up and running, or taking care of back to school immunizations or flu immunizations, our team is really there to do what is needed at the time it's needed. And so I think that's something that we have a really great team they're really boots on the ground. They're really ready to go and meet the demand of the community. Challenges around that is we are currently looking for an electronic medical record system. I'm sure that's been talked about at this meeting. So with any electronic system, there comes challenges on getting that system up and running, making sure we pick the right one, making sure we get all of our data transferred into a system. So I would anticipate that as being an upcoming, but a challenge, but an exciting one, because it will lead to a better future for us.
Okay, any other questions? Thank you, Rachel.
All right, thank you guys for giving me the opportunity
Thank
to
you.
talk to you.
Thanks a lot.
Great job. All of the division reports are in your packet, so you can look at those, or hopefully you've already had a chance to look at those. And I know that staff is on virtually, so thank you guys all for your service and the great work that you're doing.
Vivian, I've got some questions for Kathy if she's available to discuss it. on her report?
Kathy is on.
Is she? Okay.
So Kathy, could you kind of just real briefly, without going into a lot of detail, I see in this report this month, you listed here that there's been 3 closures. What was the results of that outcome from those closures?
All 3 facilities were opened up pretty, I don't want to say, I want to, maybe the next day, if not within the next couple days based on the issue.
So were these minor issues then?
I wouldn't necessarily say minor. One had no hot water in the facility. One had a roof leaking over a food prep area. And one, the walk-in cooler was completely down. I wouldn't call those minor though.
Okay. And then you've got 6 food establishments that are permanently closed. Is that due to just business or due to health department action, or where's that number come from?
That is just due to establishments that have decided to close down for good on their own.
Okay.
Is that it?
Yeah, that's all I got.
Thank you,
Okay,
Kathy.
Thank you, Kathy. All right, employee recognition. We have our April anniversaries. Rainey Crowner, 1 year. Carol Osborne, 1 year. Brian Wood, 6 years. Tina McKee, 8 years. Betty Pritchett, 17 years. And Kathy Wade, 18 years. So congratulations on your anniversaries and thank you for your service. All right, moving on to old business, discussion and action for Board of Health appointments.
Give the update. Okay. So I know this month we planned, or the board planned, I should say, to bring forth some ideas on appointments. I know there was discussion that the 3 board members whose terms were to be up, Dr. Jerger, Dr. Patterson, and Vivian Goodman, that they were all interested in remaining on the board. And so tonight, our board was to vote basically to make a recommendation to the county board chairman on whom you all would like to see appointed. So the update is that the agenda did go out last week, and the full county board meeting was held on Thursday night, and the county board chairman did reappoint Dr. Jerger, and did not choose to reappoint Dr. Patterson or Vivian Goodman. In place of Vivian, Carolyn Wagner was voted through, and then in place of Dr. Patterson, Dr. Jerry Snyder was voted through. There was discussion at the meeting, and Jeff, I know you were there, Mark, so I don't know if you'll want to add anything, but one board member did speak up and asked, or made a motion to table the vote because they wanted to respect you all as a board and give you the opportunity to actually vote on it and make that recommendation to the county board chairman. There was a lot of discussion about kind of honoring that process. And then there was a lot of discussion and concern brought forth with the representation on our board and whether or not it's representative of our community, and concerns that there are people of color being removed from our board and not being replaced with people of color, and that there are concerns from community members and county board members about that, and that the board is not representative. So there was a lot of discussion around that. I don't have minutes yet, so I wasn't able to, bring those or share those like I usually try to. But they went ahead and they voted against tabling it, and they voted through those names. Since that meeting, Sue Krause, another one of our board members, did notify me and did resign from the board effective immediately. I did ask if I could share her email so that you all could see it. I did send that to you earlier today. And so while those 3 spots have now been filled for the next terms, you now have another opening that there will need to be an appointment for. So I don't know if the nominating committee planned to bring any names forth tonight or not, but you have a spot. And if you choose to vote and make a recommendation this evening, I can communicate that to the county board chairman so that that vote can be done as soon as possible to fill that vacancy. So I don't know if there's anything I missed, Vivian, Mark, Jeff, that you feel you would like to discuss, or any questions you have for me. I'm more than happy to answer anything that's
I know you just sent that email out today about Sue, and I'm sorry to see that she's decided to resign from the board. So obviously we've got another position we need to fill. And that being said, do you know what the length of term is for her? Is she midway, or
I can look at it.
I'm just curious how long of a vacancy this
She
is
was,
going to be to
I think she
fill?
was through
Next year was-
2023, wasn't she?
Yeah, next year.
Oh, okay. We'll see.
So we're talking 1 year, basically. Is that correct?
I can look it up
No,
if you need to
yeah, I would
confirm
like
it.
to
I don't
know-
have
I'd like to
everybody's
know that.
memorized, so.
Because if we go and ask
Yep.
somebody to serve, that's probably going to be one of the first questions somebody might ask.
Well, and of course, just keeping, in mind that we did have 2 board members that are in the room that did express interest in remaining on. If you as a Board of Health are interested in now recommending one of them to be reappointed. You do have willing people.
Do you want to stay on, Ms. Patterson? Oh, okay, I thought that was good. Are you wanting to stay
I
on?
would stay on, but I think Vivian has really earned the right to stay on over me personally. She served us well as president. And so I would defer to her, actually. I mean, I'm happy to serve however, but I actually think
I'd make a motion that the nominating committee review any interested parties and bring back some recommendations to the meeting next month, since we just learned about this vacancy today. Might be premature to act on this immediately. Give the nominating committee a chance to receive other names for consideration.
I looked up Sue's term does expire in 2023. And I guess I do want to also make sure that there's time. Did the nominating committee, do you have a presentation or anyone that you wanted to bring forth this evening, other than who we've already discussed, the 2 people?
And I think to kind of avoid circumventing the process going forward, I had spoken to somebody else about this last week too, because in light of the decision that was made at the county board level, I think we need to have a better organized structure in terms of timelines that the nominating committee needs to meet and ask for recommendations in order to bring those names to the full board for consideration, and time to give the board time to do due diligence on the individuals being considered, and also give the latitude to the county board with enough notice to be notified of who those persons might be. I think that's one of our stumbling blocks, having seen this happen, last year and again this year now. We almost need to set a date that the nominating committee needs to have met and brings names to the board, because the term expires next month. And unfortunately, the county board meets before the health department does, so that kind of puts things a little backwards. So, I mean, reality is, I think by February, I would say February or March, in my mind, you have to have names in place from the nominating committee to present to the board so that we could vote on them in March, to give them to the county board for a vote by them in April, because otherwise we got our backs against the wall. The county board's got their backs against the wall, because you got a vacancy now to fill, and all of a sudden it has to happen like right away. And I think with the challenges we've got of people that want to volunteer to be on organizations nowadays, it takes time to find people, and you just can't do that at the drop of a hat. So I think we need to hold ourselves accountable as a board and the individual committees to set some dates in mind to try to stick to, so we don't stray off the path, so to speak. So, I mean, we can't do nothing about it right now, but I think going forward, next year, we need to have that as part of the bylaws, maybe amended for the nominating committee meeting specifically, to have names, solicit people that might be interested in the community, and then also bring that information to the board, so the board's got time to digest it. Kind of the same situation with the finance committee and passing the budget last year or this year, because there wasn't enough time to digest it, and we need to have ourselves in a little bit better line of time to process things. So that's something, I'm not necessarily making a motion on that tonight, but I think that's something we need to do looking forward, to put that in the amendment of bylaws. I guess that would be the appropriate way to handle it, wouldn't it, Mike?
As I recall your bylaws, you do have a specific timeline built into the bylaws for when the nominating committee is to form and meet and then make recommendations. And Brandy, correct me if I'm wrong, that's my recollection of your bylaws. And so if you wanted to meet separate from that schedule and by rule, then yes, you would need to amend the bylaws.
Okay.
I'm not sure that you can't meet earlier than what the bylaws require, so long as you do meet in accordance with the bylaws procedures in terms of forming the committee and having the committee meet. But you're probably in the safest position if it does have a specific timeline in the bylaws to consider making that amendment.
And I do want to say, and I'm not talking for the nominating committee, I'm obviously not on the board or on the nominating committee, but we have been talking about this as a board since January, and I have been reaching out to the county board chairman since January about it, trying to help have that communication so that there weren't any gaps. And I know it's not my job to do, it's the board's job to do, but I'm happy to do whatever I can moving forward, whether that's, get amended bylaws to Mike Baggett and, get that moving, or whatever it is. I think that if there is more intentional movement with it next year, then maybe that will help with the communication with the county board as well, because they do still have another meeting before the terms end. So I think that there could have been time, and I received no communication until that day of who was even being presented. So I don't think that the nominating committee all received that either. So I don't know if there's something that the nominating committee can do rather than me do it, to work with the county board and county board chairman to help move that process and have better communication. But if there is something that I can do to help with that, I'm happy to. I just don't know that it is my role or maybe the most effective way for it to happen, since it hasn't really happened that way over the last couple of years. So if there is anything I can do, please let me know. But I hope that the nominating committee can kind of take that moving into the next year.
So the two people appointed were the county board presented them. It wasn't from our nominating committee. Is that right?
Correct, the county board chairman.
Okay.
Well, I would make a motion that we have anybody that's interested in filling this unexpired term of hers to submit names to the nominating committee by no later than next month's meeting. And that way we can take action on it next month if that's what we choose to do.
I mean, it's up to all of you. You just let me know if there's something you want me to do for that. I will do it. Like receive them, or if you want them to go straight to the county board chairman, if you want it to be done that way. If you're wanting some communication out to the community, trying to help, recruit people, let me know specifically what you would like for me to do in addition to what I've already, been doing with that.
Okay.
So do we need to make a motion on that or not?
I mean, I
Mr.
don't
Scranton, I
think you
believe
do.
the motion is already on the floor. I don't know if there has been a second. Without a second, the motion would die for lack of a second.
I'll second Mark's motion.
Okay. So can you repeat the motion, because you said several things
I'd
there.
make a motion that the board members provide any names for consideration to fill Ms. Crowell's vacancy be given to the nominating committee by no later than next month's meeting, prior to next month's meeting, for consideration.
Okay. And, yeah, okay. All right. So a roll call vote.
Vivian Goodman,
Yes.
Mark Scranton,
Yes.
Jan Hack,
Yeah.
Candy Kelvinger.
Yes.
Jeff Entler,
Yes.
Debbie Hill.
Yes.
Cody Parks.
Yes.
Dr. Janet Pedersen.
Yes.
Okay, motion carried. Thank you. So we'll move right into the attendance review under new business, the nominating committee, or do we even need to bother with that? Or do you guys have a report on the attendance review?
No.
No? Okay. All right, then Mark, you're on.
Okay. I got several phone calls last week about something that I was kind of unaware of, and some of them were pretty adamant about their displeasure about some things. And the way Brandy explained this to me, if I understand this correctly, these posts that were put online came from another source. Is that correct?
Yes, it was National Public Health Week information.
So I've got copies if anybody wants to have this to look over, but some of the things that were put on the health department's website, I had several people felt very strongly that some of these positions that were being presented had absolutely nothing to do with health and the health department, but rather promoted an agenda. And I'll just read you the titles to them. And like I said, one titled "Racism: A Public Health Crisis," World Health Day, "Health is a Human Right," "Collaboration and Resilience." Didn't quite understand that one myself. "Closing the Health Equity Gap," and then the one that probably got the biggest negativity on, which I hate to say because Rachel did a great job with the presentation on it, getting the link back open, was the appearance of the post in regards to STIs and a safer sex game plan. It just, the connotation of how that was written didn't sit very well with a lot of people. And then something in regards to climate change. I don't know, I'm just sharing that with the rest of the board. I had probably at least 6 people contact me. I actually had 2 county board members that also called me about this, and were very concerned that it appeared that there was an agenda of certain topics being promoted on the health department's social media page, and they didn't think that was appropriate topics for them to be putting on there. And I apologize, I tried to print these off. There were some comments actually attached to some of these posts that was made, and I would say an overwhelming amount of comments were very negative about these things being put on there. So I just think that we need to do a little bit better job of what we put online, because people obviously do read it, and you very rarely hear from anybody unless it's something that people have an issue with. So I just think moving forward, we need to think about some of these things. I would have never expected this to come directly from the local health department, so I understand that this was brought in from another source, but I think it could have been vetted better and maybe chosen to either maybe not necessarily remove certain things, but decide if there's an appropriate topic in regards to public health. So I just want to make everybody aware of that, but I've got copies. I brought with me if anybody wants to have those later to look at, but I just want to make everybody aware of that concern from the public.
So Mark, are any of those issues not affected by public health, or do they not affect public health?
It's the manner in which they were presented that I think most people had a problem with. There's some things in there I didn't, I read through them, there's some things there I didn't think were relevant for the health department at the local level. But I think the presentation and the message is what most people had a problem with. That's the feedback I got from people that I talked to. They just didn't like it. So I think the message could have been done differently, probably would have made people a lot happier.
So again, we're back to the issue of not everyone is always going to agree with everything. It was National Public Health Week. They had information from the national level. I mean, what do we do? Say,
I'm just,
no, we're
I'm
not
just bringing
gonna,
it to the board's attention. People in the community were very negative on this, heard from several people, and most things we have that come before the board, you very rarely hear public comment, either in person or in response to something specific that's been put out there. I'm just bringing it to the board's attention and making them aware of it. I mean, I didn't have any comments that I saw either online or people I talked to that were positive, I can tell you that. So just sharing the information.
okay, well, thank you for sharing.
Did the
Sure,
health
Brandy, you
department
wanna,
have any feedback or any comments from the public?
The only, excuse me, the only comments that we got were some Facebook comments, which there were positive and negative. And as you all probably know, if you're on social media, people are a little braver to make negative comments or to be hateful. And an overwhelming amount of comments, I think, is not necessarily an accurate depiction, because some of the negative comments were by the exact same person saying several things and being argued with from someone that did like the post. I received no other complaints other than Mark's email calling it garbage. And that was in reference to the climate change, taking action for equity. And I've got to say that, among many other things that I would like to say about this, this is National Public Health Week, was part of what he referred to, and CDC information, the Safer Sex Game Plan, that was all CDC stuff. It was vetted. I may not see every social media post, but I can tell you right now, I directed for the National Public Health Week post to go out, and I stand by that decision. If people don't like that something is packaged, talking about racism, equity, disparities, disproportionate impact for people who are disabled or people of color in our communities or people who are low income, that's their problem with not liking packaging of the truth. These are public health issues, and I know Mark in his email to me called that, it said something about us being an agenda mouthpiece for political or social issues.
I'm stating
Public
what
health
people
is-
told me their opinion was about what they saw. That
And you
wasn't
also
coming
called
from
it
me
garbage.
personally. Well, that's what people told me they felt like it was.
Okay, it seemed like it was coming from you, and you also demanded to know who
I just
posted
conveying
it.
the message that this is what I heard from people.
Okay, that's fine. But what I'm saying is that as our board, we need our board members to believe in public health, understand the mission and the purpose of public health, understand our responsibility. And while it's really hard to talk about some of this sometimes, it is our job to put that out there. That is what public health does. When we're talking about things like STIs, yeah, they don't make people very comfortable. When we talk about having safe sex or having a safe sex game plan so that you have a plan ahead of time of how to conduct in sexual activity in a safe way, that is what public health talks about. When we talk about parents having babies and not having support or not having a ride to the store or not having formula, that is what we do. That is our job. So my mind is blown, honestly, and with all respect to all of you, that I would hear negative comments from a board member or a board member that doesn't want us to package public health messaging, or that says this is not related to public health, or to say do the message differently so people will be happier. Public health isn't always pretty. The state of our world is not always pretty, but that's why we're here, and that's why it's so important what our people do. They show up and deal with the ugly, scary, uncomfortable things that people need. Like these posts, I went through every single one after I heard from Mark. And I looked and read every single one. I stand by every single one. These are all true. This is stuff that people live through, real people, and it's not pretty, and it's really not pretty for them. So if you don't understand it, I think good. Like that's great for you that you don't have to understand it. But the people that we serve, they do understand it. They do live it, and it's our job. And I am not okay to be told that our stuff should be censored, or our stuff shouldn't be packaged in a way that's truthful and honest. And I know I probably seem passionate right now, but this is, to me, another example of us being told what we're doing is garbage or wrong because people don't like it. Who are these people? You know, I'm not getting direct complaints. I'm hearing about, social media and people that are talking crap on social media that no matter what you post, some of them will have negative to say. And then I just want to make sure I didn't miss any points before I stop talking. We're not taking a stance in the political arena. That's not what we do. But some of the things that we talk about end up becoming political issues. We do not side on politics. I don't get into that. Like the health department doesn't get into that. We're here for truth and we're here for meeting people where they're at and giving them the services. And it is our job to be inclusive, diverse, accessible, and brave in our communication and efforts. These things should not be controversial. This is absolutely 100% public health. And I just ask you all as a board, even when working with one another or with working with my team, that you do support that. And if you don't understand a message, that you come and ask me rather than presenting something in your case to me as why, that this is garbage and you demand to know who posted it.
So the public doesn't have the right to express their opinion on
They can
something.
express it. They can absolutely express it, but I don't think that we can change our communications or censor them and not be transparent or not do our jobs. Then what are we? I mean, if we just go by the sway of the wind of what the public always wants or always thinks looks pretty or is easy or whatever, like we're not doing our jobs. And in my opinion, that is unethical and I can't stand by that in this position.
But at the same time, we work for the public, and if the public is not happy with how things are being done, they have a right to have a voice at the table.
Absolutely.
That's what we're here for.
Absolutely, they have a voice. You're
So we
right,
should
but it
not
doesn't
be-
mean they're always
should
right or
not
that we
be
should
negative
change.
about people's
I'm not.
opinions, whether they're negative or positive, one way or another. That the public has the right to give their
They
feedback.
do.
Every person I talked to, I told them, I was only aware of one particular item myself personally that I looked at and kind of scratched my head about it, but I didn't think that much about it. Then I had other people call me. I told them all the same thing. I said, I don't understand why this has been put on there. If you got questions about it, to call you. And that's where I left it at. Because again, I don't understand certain topics and why they're posted. That's why I asked you where this information came from. So if people choose to follow up with you, either in person or phone or email or whatever, that's fine. I mean, there's always going to be people that are unhappy on a particular topic, as we've seen have happen here in the past. We make decisions about things. I just wanted to bring this to the board's attention and say there were some people that were very upset about how some of this information was provided, out there, and they just weren't comfortable with some of the terminology and some of the things that were being said. And I think if we don't say nothing about it, everybody thinks it's okay. And then the next time when we have maybe something a little bit more of a serious nature, then we may create more conflict that way. I'd rather know where this is coming from and how we're going to handle it going forward. But I think people have the right to express their opinions. And I think if we start taking a defensive, mode and saying you guys can't say anything negative because you're not educated or whatever, I think that sends a bad message to the people in this community. And I mean, we're here to serve the public. I mean, that's why I've asked every single month for the last 8 months, when we're going to get an STI clinic open. And we're now finally getting it done. But that's part of my concern I've had is the health department is here to serve the public in a lot of different needs. But yet for the last almost 2 years, the primary focus has been dealing with the COVID issue. We have other services and other needs that we have a obligation, responsibility to take care of the needs of the public. These other things didn't magically go away for that period of time. And I'm glad to hear we're finally getting this clinic back open. I've asked about every month because I see the report that we got over 100 cases, every month, but yet we're not able to function to do anything. And I think we have to really think about where we're going forward, because this type of situation could come up again and we need to be prepared to answer the call and not just single out one particular health issue and say the rest of you just gonna have to sit and wait. So that's kind of my opinion on that. But I do appreciate the fact that's being started up again. But I want to educate the board on the public's opinion on some of this stuff.
Well, I do want to clarify, I did not say in any of the time that I was talking that I don't want negative comments from the public or that anyone is uneducated. I didn't say that. We've gotten plenty of negative comments over the course of my career here, and we handle those very professionally. What I'm saying is having support of board members is helpful, and I ask for that and appreciate it, and that you're going to get negative no matter what. I did not say that. And then as far as services, we did not shut everything down except for COVID. That is not accurate either. Every essential service was running except for the full STI clinic. We were still even offering STI services throughout. We just now are having the full-blown provider here and everything starting in May. So it is not accurate to say that we shut everything down and we couldn't operate or function. That is not true at all. We've been running our essential services. That's part of why people had a lot of flex time, because not only did they have to do their COVID job, but they had to do everything else that they were required to do in their regular job. So that's not accurate. We've been doing everything pretty much throughout the entire time. And I did keep the board updated throughout the entire pandemic that we've been in on what is going on. And I think it's safe to assume and know that as the lead incident commander and lead responding agency in a pandemic, as the health department in a county, that we would have a lot of responsibility. But I do stand by that we continue to provide essential services for our community during the pandemic as well.
Okay, thank you. All right. Discussion and approval of home med subcontract and business associate agreement.
So this was in your packet. I know the state's attorney's office is reviewing it, so I don't have a final, so I can bring back what I have next month, but I just wanted you to be aware of this. This is something, I know I put some information or recommendation for action in my board report, so I won't like repeat every single thing unless you want me to, but basically this is a referral program essentially that we can refer our clients that we already are seeing in our Starting Point Division, the Aging and Disability Resource Center. This is a program we can refer them to. There is no minimum requirement. The maximum number of people we can refer in a year is 90. And these people get their medication lists reviewed and also whether they've had falls, just to determine if there might be any kind of contraindications or anything that could be putting that client at extra risk. So it is most of the work we are already doing other than the data entry that is associated kind of on the other end of the home visit, but we would be able to receive money for referring and then also billing casework through our regular operations. This is something that we see as a possible way to help bring in revenue in our Starting Point division as more clients are being transitioned to managed care organizations. So this is a way for us to help with financial sustainability and also, of course, providing referrals for our clients in addition to everything else that we do for them. So once we do have a final contract, I do recommend that you all would approve that so we'd be able to do it. They do know that we have to have it approved, so they know there might be a little bit of lag time going through the full county process. And then we did get a brochure. Our director of Starting Point, Teresa Smith, she did attend the training, it happened to be today. So she had a brochure, so we went ahead and brought those copies just kind of as an FYI. I'm happy to answer any questions if you have them. I believe Teresa's still on if you have questions for her, but I do think we need to wait until next month to approve so that I have that final contract for you.
You're saying this will only benefit 90 people? That's the maximum amount that we can have
For
in
the
this program?
year, yes. For this specific program only.
So how many potential clients are not going to be able to take advantage of this then?
So they have, Teresa, are you on? I don't remember exactly how many clients
Yes.
you have right now. Okay, go ahead.
Yes, I am on. We serve almost 1,000 clients, and this is for clients. I mean, they do have to have some criteria that they meet. So they'd have to have a certain number of medications. They would have to either have been hospitalized or had a fall. And it's all based on whether or not the client wants to be enrolled in the program. So similar to every other referral we make, for example, to home delivered meals, it's something that we present as an option. And if they do want to go forward, then we would make that referral. As far as only having 90 that can be enrolled, there is no maximum on the amount that can be enrolled in the program. There's simply a maximum on the contract for the amount that we can be reimbursed for. So if we got to 90 and there were still people needing the service, we would most definitely still make the referral because that's what we do in our comprehensive care assessments. We would still make the referral. There wouldn't be reimbursement for our time on that. We could still be reimbursed for the casework portion of it, which is through the community care program. But for this specific contract, the $55 that we would get for each one, that is capped at 90 in the contract.
So I'm confused. We could have more than 90, but only 90 gets covered. Is that what you're saying?
We would only,
Yes.
so, oh, go ahead, Teresa, sorry.
Oh, that's okay. Yes, we could have more than 90 referrals. We would only get reimbursed for the 90. And it's just the way the grant is written through age options for this first year that we're participating. It's capped at 90 because there's a cap on the amount of grant monies awarded. So.
But they still check on them and do follow through.
Absolutely. They would still be fully enrolled in the program. They would still have the pharmacist that would review their medications. If he does find an issue, they would still get reports, all of that. We would definitely not enroll somebody who needs enrolled. It's basically just another option for us to make referrals to a newer program in the community to make sure our seniors have all the resources they need to be able to stay safely in their homes.
So if we get reimbursed at the 90, then does the money for anything above 90 then come out of the health department budget somewhere? Where's the break off on this at?
I don't believe it be coming necessarily out of the health department budget. It's still going to be included in our comprehensive care assessment, which is, I mean, we get reimbursed for each care assessment we do through the state of Illinois. So it's still covered in a comprehensive care assessment. It's almost, can be considered almost an added bonus that we're getting the $55 for up to 90.
So it's covered under a different program then. So the client or patient's not paying for it and the health department's not paying for it, right?
I believe that to be correct. Brandy, would you agree with that?
Yes, I do.
So is this something new?
No.
I mean, have we done something similar to this in the past? Or is this just a new third-party provider?
We've not done this specific program in the past. It's kind of a newer program as far as the home meds portion of it. It's not something that we've been able to offer in the past. They're trying to roll out this new program. So it's another resource for our clients.
So is this a discount program for the medications then, or is there an actual cap on dollars that the person's able to spend?
No, this has nothing to do with the cost of their medications. It's simply having their medications reviewed by an online pharmacist. So we put all the information into the home meds computer program. And if they see any issues with the medications that might be causing falls or hospitalizations, then that pharmacist would flag it and send us a report. We would be able to contact the client, let them know the outcome of the report, and then see if maybe they need to see their primary doctor, see if maybe they're taking two of the same medications. They came home from the hospital with a blood pressure medicine. They've already taken a blood pressure medicine and they're taking them both now. So just different things that might cause concern.
So you're looking at a lot of issues potentially with contradictions in medication. That sounds like.
Correct. Yes, and a lot of
Okay.
our seniors are on a lot of medication. We're just trying to give them another tool to prevent that.
Okay, makes sense.
The medication part is a new program, newer, but the starting point is.
No, starting point's not new. Yeah, the community care program Teresa's talking about, that's been here, yeah.
Oh,
So this has to go through Mike to get reviewed then?
Yes.
Since it's a contractual agreement, okay.
I think he's gonna see.
I have the agreement. I have not finished reviewing it yet, but I was in it last week and I got sidetracked by a trial that came up this week. So hopefully now that the trial's over, I can get something done, maybe get something to Brandy by the end of this week or next week.
Okay, thanks.
Okay. So you'll bring it next month?
Yes.
Okay. So anything for a closed session?
No, I just had it on there as a placeholder in case you all need it.
Okay. So nothing else. I will entertain a motion to adjourn.
Second it.
Who was first? But you need the
Sorry,
motion. You want to
I
be
need a
first?
motion.
Yeah, I'll do first, I'm sorry.
Okay, Cody,
I second.
Debbie. Cody and Debbie.
Thank you. Roll call vote.
Vivian Goodman,
Yes.
Mark Scranton,
Yes.
Jan Hack,
Yes.
Candy Clevenger,
Yes.
Jeff Entler,
Yes.
Debbie Hill,
Yes.
Cody Parks,
Yes.
Dr. Janet Patterson.
Yes. Okay, motion carried. Meeting adjourned. Thank you, everyone.
Thanks, everybody.
Thank you, staff.